Hello everyone, my name is Dr. Chong Hong Yin. I'm a consultant general and colorectal surgeon. What is colorectal cancer? Basically, our colon or large intestine are divided into two parts, mainly the colon, which is from the small intestine all the way to the rectum, and this part, which is the straight part, is connected to the anus, we call the rectum. So this whole part, we call it the colon, and this part, we call it the rectum. So if you have cancer in any of this part of the large intestine, we will define it as colorectal cancer. There's another part or another form of cancer, or which we call the small intestine cancer, where the cancer occurs in the small intestine, and this is totally different from colorectal cancer. So basically, what are the symptoms of colorectal cancer? If you look at the colon, we can divide into the left side and the right side of the colon. The symptoms are a bit different. If for the left side of the colon, the commonest symptoms is rectal bleeding. That means passing motion with blood. Okay. Other symptoms is like there are changes in toilet habits. Okay. Example, you might have constipation, or the sudden increase in stool frequency and consistency, diarrhea, that lasts for about few weeks. Other symptoms include difficulty passing motion, abdominal pain. Sometimes you get a weakness, loss of appetite, and loss of weight. For the right side, if you have cancer on the right side, the presentation is a bit different. Mainly, you won't get rectal bleeding, but you might get passing out blackish stools. That means you pass motion, but the color of the stool is black color. And also, it might be associated with anemia. And sometimes you might have abdominal pain, or you might even feel a mass or a lump at the right side of your abdomen. But for small intestine cancer, the presentation is totally different from large intestine or colorectal cancer. Usually, you will get abdominal pain or discomfort, or if the tumor is big enough, it might obstruct your small bowel. That's when you get vomiting and also belching, and you might not be able to pass motion for a few days, and also abdomen distension. So if you look at it, the presentation is totally different for small intestine cancer or even for colorectal cancer. According to the National Cancer Registry Malaysia for the year 2012 to 2016, colorectal cancer is the second commonest cancer in this country. It is the commonest in male and the second commonest in female. It is also the most commonest in Chinese, followed by Malay and Indians. And unfortunately, most of the cancer, nearly more than 50% of the cancer are detected at the late stage, mainly stage 3 and stage 4. So how do we screen for colorectal cancer? At the moment, we recommend anyone above age 45 years old should start to go for screening. How do we screen it? There are a few ways to do it. Number one, we can do a FOBT or fecal occult blood test, or the FIT, fecal immunochemistry test. How do we do it? Basically, we take a sample of your stool and send to the lab and check whether there's any presence of blood in your stools. Okay, if your result is positive, you should undergo a colonoscopy. A colonoscopy is a procedure where we will insert a scope from through the anus to have a look at your whole colon under sedation. If we see any tumor, we will take a biopsy and send to the lab and to confirm whether it's a tumor or cancerous or non-cancerous tumor. So how frequent do you need to do screening? Well, at the moment, it is recommended you need to do your FOBT or fecal occult blood test at least once a year, and a colonoscopy at least 10 years once. So if you are diagnosed with colorectal cancer, the next step we will do is staging. Staging basically is to determine the stage of your cancer, the disease. So how we do it, can be done by doing a CT scan or a PET CT scan. Once we confirm the diagnosis and the stage of the disease, the treatment is tailored according to the disease and the stage of the disease, and also depends on the overall health well-being of the patient itself. So the treatment of colorectal cancer consists of a few modalities, mainly surgery, chemotherapy, radiotherapy, and also newer treatments like targeted therapy and immunotherapy. The first step is to remove the tumor. Okay, there are a few ways we can do it. Number one, we can do it as an open surgery, which is a traditional method. We make a big incision and remove the tumor. Nowadays, we can perform surgery, or what we call a keyhole surgery. which we have a smaller scars, smaller incisions, and also less pain after the operation. Newer technologies we have currently are robotic surgery, which like the laparoscopic keyhole surgery, patient will have a smaller scars and also less pain, faster recovery, and less complication compared to the conventional open surgery. So my advice is, don't ignore any bowel symptoms. Example, even if you have rectal bleeding, don't think it's nothing, because any symptoms is not normal. Go and seek advice early. Example, you have any changes in toilet habit or any rectal bleeding, go and see a doctor. Go to your nearest GP or go to your nearest hospital and seek treatment, and do a proper screening, proper test to make sure that you don't have colorectal cancer. And even if you have cancer, don't be afraid to seek treatment. Get a professional help. Listen for your opinion. Listen to the type of treatments you have and the modalities and the side effects. And the most important thing is, if you detect early, proper treatment, the cure is high.